Hello everyone, and welcome to our channel. I'm glad you could join me today. We're going to talk about something very important for many of us as we get older: high blood pressure. You might hear doctors call it hypertension. Think of it like this: your blood vessels are like hoses, and your heart is the faucet. High blood pressure means the water, or in this case, your blood, is pushing too hard against the walls of those hoses. Now, why does this matter, especially for older adults? Well, as we age, our arteries can become a bit stiffer and less flexible. This is a natural part of getting older. This stiffness can cause our blood pressure to creep up. It's incredibly common, but just because it's common doesn't mean we should ignore it. Uncontrolled high blood pressure is a major risk factor for serious health problems like heart attacks, strokes, and kidney issues. The good news is, it's very manageable. So how do you know if you have high blood pressure? The tricky part is that it's often called the silent killer, because most of the time, there are no symptoms. You might feel perfectly fine. That's why regular checkups with your doctor are so crucial. The only way to know for sure is to have it measured. A normal reading is typically below 120/80. If your numbers are consistently higher, your doctor will talk to you about what that means. Let's imagine you're at home and you use a home blood pressure monitor and you get a very high reading. What should you do? First, don't panic. Stress and anxiety can make your blood pressure go up even more. Take a moment. Sit down in a quiet place. Relax for 5 to 10 minutes. And make sure you're seated correctly, feet flat on the floor, back supported, and your arm resting at heart level. After you've relaxed, take the reading again. Sometimes, a single high reading can be a fluke. Maybe you rushed to sit down, or the cuff wasn't on properly. If the second reading is still very high, let's say the top number is 180 or more, or the bottom number is 110 or more, it's time to take action. If you're also experiencing symptoms like chest pain, shortness of breath, a severe headache, sudden weakness, or vision changes, this is an emergency. You should call for emergency medical help immediately. Don't try to drive yourself. If the reading is very high but you feel fine, it's still important to contact your doctor's office right away. They can give you advice on what to do next.
Steady improvement. We just need to monitor it closely.
I see. So the new medication is working.
They might ask you to come in, adjust your medication over the phone, or monitor your pressure at home for a while. Never, ever change your medication dose on your own without talking to your doctor first. That can be very dangerous. Consistency is key when it comes to blood pressure medicine. Now let's talk about the long-term plan. Managing high blood pressure is a team effort between you and your doctor.
All right, that makes sense now. I'll sign right here.
Medication is often a big part of the solution. There are many different types of blood pressure medications, and your doctor will find the one that works best for you with the fewest side effects.
And are there any side effects I should watch out for?
It's vital to take your medicine exactly as prescribed, every single day, even if you're feeling great. Remember, the medicine is what's keeping you feeling great. But medication isn't the whole story. Lifestyle changes can make a huge difference. And they can sometimes even reduce the amount of medication you need. Let's talk about food. One of the biggest things to watch is your salt intake. Too much sodium makes your body hold on to water, which increases the volume of blood in your vessels and raises your pressure. Try to avoid processed foods, canned soups and fast food, which are often loaded with hidden salt. Instead, focus on fresh fruits, vegetables, whole grains, and lean proteins like fish and chicken. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is a fantastic, well-researched eating plan for this. Next up is movement. Gentle, regular exercise is wonderful for your heart and blood vessels. You don't need to run a marathon. A brisk 30-minute walk most days of the week can do wonders. Swimming, water aerobics, and cycling are also great low-impact options. The key is to find something you enjoy, so you'll stick with it. Always talk to your doctor before starting a new exercise program to make sure it's safe for you.
All right, doctor, I will read this carefully.
Maintaining a healthy weight is also very important. Even losing a small amount of weight, just 5 or 10 pounds, can significantly lower your blood pressure. It takes some pressure off your heart, which doesn't have to work as hard to pump blood around your body. Another lifestyle factor is limiting alcohol. While a little bit might be okay for some, excessive alcohol consumption can raise your blood pressure quite a bit. Talk to your doctor about what's a safe amount for you. And if you smoke, quitting is one of the absolute best things you can do for your blood pressure and your overall health. Smoking damages your blood vessels and makes them narrower. Finally, let's not forget about stress management. Chronic stress can contribute to high blood pressure. Find healthy ways to relax and de-stress. This could be gardening, listening to music, practicing deep breathing exercises, gentle yoga, or spending time with loved ones. It's about finding what brings you peace and making time for it in your daily life. To wrap up, high blood pressure is a serious condition for older adults, but it is highly manageable. Remember to get regular checkups, take your medications as prescribed, and embrace a heart-healthy lifestyle with good food, regular movement, and stress management. Thank you so much for watching. I hope you found this information helpful. If you did, please give this video a thumbs up and consider subscribing to our channel for more health tips for seniors. Stay safe, stay healthy, and we'll see you in the next video.